You're pregnant, you're having heartburn at 3 a.m, you're constipated all the time, you have to rush for the toilet every 20 minutes. These are called common pregnancy symptoms. I'm Zainab, I'm the pharmacist from PillSorted, and I'll talk about the biology behind these common symptoms and how can we manage it. Most of the pregnancy symptoms are derived from 4 things. One is your hormones, the other one is the circulation, so changes in your fluids and your blood. The third one is the pressure from the baby, and the fourth one is the changes in your joints and your posture. All of these are necessary parts to have a successful pregnancy. I'll bring here as many of the symptoms that I can and give you a small brief way to make them easier and more manageable. Okay, the first one that you'll experience is probably the nausea. That comes up from the HCG hormone right at the beginning of pregnancy in the first trimester, and it usually wears off around week 12. The best thing that we can do, again, for pregnancy, we want to go everything natural, so don't go for chemical medications as much as possible. Mint tea is one of my favorites. It's helped me throughout my whole 3 pregnancies, but you want to go for small sips of cold liquids or herbal teas that could help you with this nausea, as I said, mint tea, and don't go too hungry. So try to force yourself to have that tiny bit of hydration and food that will help the nausea get better. The second symptom is heartburn. The culprit for heartburn is actually progesterone. It relaxes the barrier between your stomach and your throat, so you feel that bad taste in your mouth. The best thing is to sit put after eating. Don't eat too big of a meal so it goes down and stays down for longer. Avoid spicy, fatty food that will make it harder to digest. The other one is constipation. Constipation stays throughout the whole of pregnancy, and it's really important to be able to manage it because straining at the last trimesters is really difficult. You want to be able to manage it and be on the soft side as much as you can in most of your pregnancies. Again, progesterone is the culprit behind it. You want to have fluid, you want to have fiber and gentle walking as much as you can. These are the 3 important things towards constipation. Natural things, either they're fiber forming or they are laxatives, both in fruits and vegetables. There's lactulose as well. These are perfectly safe to take. The other one's swelling. So there's so much extra fluids in your body, and these fluids can cause a lot of swelling, especially in your lower body, your feet, and your ankles swell. Try to elevate your feet or have lie down naps in the day. That's really important. It really helps. I got to this understanding on my 3rd pregnancy. After the first and the second one, I had a lot of swelling. So if you put in those lying down naps, even just a couple of minutes throughout the day, it really helps with relieving the swelling, especially on the 3rd trimester. Movement is really good as well. If you see sudden swelling in your face and your hands, that's something that needs to be checked. Headaches, again, hormone changes, all of them can cause headaches, but most of us are working to the end of our pregnancies and the 3rd trimester. So the combination of not being able to sleep properly at night time, getting dehydrated more, all of these can bring up the headache as well. So try to put enough sleep. Don't rush to get everything sorted as fast as possible. You really need to plan your energy expenditure. You need to plan your rest much more carefully during pregnancy. Then the other one is the pelvic and the back pain. There's so much changes that are happening in your body. Most of all is because all your body is getting prepared to be able to stretch out as much as possible, and that means your ligaments are becoming much more softer. Gentle exercises are really good. They really help at this time. And the other important thing is walking. You will realize that your gait and your walking will change, so you will start to be waddling a little bit more. That's perfectly fine, and as much as you can, keep on walking. Walking is one of the most underrated but most useful exercises that you can do because it coordinates a lot of your muscles in your body and helps with that balance. But do them as short and as frequent as you can. Instead of going for a very long walk, go more frequent walks and more often. Now, tiredness and fatigue. You'll experience it a lot more in the 1st trimester because there's all of that foundational work happening in your body, but it might happen any time throughout your trimester. trimesters as well. The second trimester usually a lot more full of energy because you're doing the nesting, getting everything ready. The third trimester, the pressure of the baby is a lot more and you're moving a lot more bulk when you're doing anything. So that makes you tired. The other thing is that the tiredness might come up very fast. So you're suddenly full of energy, you're cooking, but then straight away you feel, I need to sit down. It's okay. These are quite normal. This is a symptom that you need to be able to manage. Plan in enough rest in your day. Consider that you're having much more challenging sleeping times and situations. So for your sleeping, start getting ready into that. You need to sleep on your side and you need to have enough pillows to protect your back so that you're not completely having your weight on your tummy, but you're not completely fat on your back. So it's an angle that you need to practice and you need to find what works for you. It's helpful to have a couple of pillows between your legs as well, so that again is not bringing pressure on your pelvic and the baby itself. Feeling dizzy or faint a little bit. Your hormones are changing a lot. There's a lot going on in your body, especially with the blood circulation. So it is possible that you suddenly have a little bit of a drop in your blood pressure. Your blood pressure would generally be a little bit lower in pregnancy anyway. If you feel dizzy, try to get yourself settled somewhere so you avoid having a fall, and try to have something rehydrating like electrolytes with you, or a little bit of a salty snack or a little bit of a sweet snack, so these can help replenish and get your blood pressure back up. Now, feeling hot and sweaty, it's as if you've got a radiator built in inside you. There's a lot of, again, changes. Estrogen makes you feel really hot as well, and all of that extra blood volume that you have. So just try to keep cool, have cotton clothes on so you don't sweat, it doesn't get your skin folds on each other and getting itchy. Drink plenty of liquids. Needing to go to the toilet a lot more. That is one of the changes that happens a lot. There's extra blood flow to your kidneys and there is a lot more pressure on your bladder from the uterus, so it really is squeezed for space. If before you could go on with a couple of hours not going to the toilet, the size of your bladder is not changed but is much more squeezed, so it can't keep that much wee in it anymore. So that means it will make you go to the toilet more often. And the other thing is having a bit of a incontinence. We're going to talk about pelvic floor muscle exercises, which can relieve both the pelvic pain and help relieve this, leaking and incontinence. It is a normal part of these symptoms, and we'll talk about how to get those better. And about skin changes. So the most important skin changes happening is around your tummy area because it's getting bigger and bigger. So all of your skin is stretching out, and that's where the stretch marks happen. So there are these like silvery lines where the skin is opening up from each other. You can't do much about it, but keeping it moist is really helpful from relieving the discomfort and the itchiness about it. From the beginning of the second trimester, even if your tummy is not grown that much, but get into the habit of moisturizing your skin because it will help that extra layers opening up not getting disrupted too much. Also, you'll see some changes around your breast and your nipple areas. They become darker, they become larger. Again, these are natural parts of the pregnancy. The last one that I want to talk about, bleeding gums and nosebleeds. Again, this is because of that extra blood circulation in your body. Make sure that you keep on brushing your teeth quite regularly. Keep a good oral hygiene. So that's the important thing that you can do about, but it's quite normal. So you can use a soft toothbrush at this time. That's a good one. If you have started your pregnancy with being overweight, some of these symptoms become much harder. So for example, you might have more of the indigestion and heartburn. You might have more of the joint and the back pain. Your blood sugar might be a little bit more unstable as well. Again, it's really important to make sure that we put that regular steady nourishment in place and not have too much of the crashes and too much of the cravings. My suggestion is to have small meals throughout the day, join the carbohydrates with the protein and a fiber, and that will make you have a better outcome. Again, there are lots of safe medications that you can take during pregnancy. So paracetamol is usually absolutely fine, but most of these symptoms should be manageable without taking extra medications. Reach out to us if you need any advice about taking anything that you're not sure of during pregnancy. This video is part of our pregnancy series videos. Visit our website and reach out to us for that clinician-led safe advice. Thank you.